Hello, I'm Dave Coghill. I'm a child and adolescent psychiatrist, academic child and adolescent psychiatrist based at the University of Melbourne in Australia. I've been working with children, young people and now young adults with ADHD for many years now, and it's a real pleasure to be able to talk with you. There are many common myths and misunderstandings about ADHD, particularly about the stimulant medications that we use to treat ADHD. In this sequence, I would like to highlight 4 of these myths and look at what the evidence says about them. The first myth that I'd like to talk about is that ADHD medications are addictive and increase the risk for substance abuse. As far as the first part goes, there's no evidence at all to suggest that ADHD medications are themselves addictive. But maybe more importantly, there's also no evidence to suggest that they increase the risk for substance misuse. On the contrary, while ADHD itself does increase the risk of abuse and misuse of a wide range of drugs, including not only illegal street drugs, but also alcohol and nicotine, it's now clear that treating ADHD with medication decreases rather than increases these risks. That's not to say that ADHD medications, particularly stimulant medications, are never misused. They can be. My experience is, however, that when this happens, it's usually where people are using them as cognitive enhancers in an attempt to increase their productivity at work or at study, rather than misusing them as party drugs to get high. Another common myth is that ADHD medications are going to change someone's personality. Here, the truth is a bit more complicated. It is true that you can become a somewhat different person when ADHD is treated effectively. The kind of changes that we see are those that we're aiming for: better focus, increased motivation, less impulsive behaviours, and often being more able to manage emotions. So yes, the ADHD medications do, in that sense, change who you are. But they do this by improving these aspects of functioning that have previously been challenging and that contribute actually to the diagnosis. This, I think, is very different from changing your personality. I do, however, sometimes have parents that will come and say, "Why is my child so quiet? You've changed their personality." When we explore this and dig a little bit deeper, we almost always see that their child, who's previously been over-exuberant and had difficulty focusing and often is quite disruptive, is now behaving just like a typically developing child without ADHD. This is quite strange for the parent to see, and something I always discuss now before starting treatment. It is, however, also a testament to just how effective ADHD medications can be. While I do routinely warn patients and parents about this, it's also important to be careful not to oversell the treatment, because some people can be really disappointed if the first medication you try is not as effective as they've hoped for. Another related concern that parents and patients often raise is that they've heard that ADHD medications change the structure of your brain. Again, this is quite an interesting one, because there is actually some evidence to suggest that there are differences between the brains of children and adolescents with ADHD who have taken medication and those who have not taken medications. But what's particularly interesting here is that the brains of children who have taken medications appear to be more like the brains of typically developing children and adolescents than the brains of those with ADHD who have never taken ADHD medications. Now, it's not possible from this data to prove that it was the ADHD medications that led to a more normal pattern of development. But there certainly is no indication that the ADHD medications are interfering negatively with brain development. However, It is also important to note that while ADHD medications have been shown to be very effective at reducing the symptoms of ADHD, these effects only last for as long as you continue to take the medication. And for the stimulants, these effects wear off at the end of every day. So in other words, they are not a cure for ADHD. So it really would seem that at a functional level at least, the effects of these medications on the brain are temporary, and that any changes in brain development are not associated with increased rates of remission from ADHD. Some critics of medications for ADHD argue that the fact that ADHD medications reduce symptoms but don't change the course of the disorder as an argument for why we should not be prescribing them. But I think it's important to remember that this is similar to that for many other treatments for physical illnesses. For example, we have very effective medications to control blood sugar in diabetes, blood pressure in hypertension, but none of these are actually curing the underlying disorder. What is important is that the evidence is now emerging from large population data sets that people with ADHD who are treated with ADHD medications have much more positive outcomes across a wide range of key life experiences, such as improved educational outcomes, improved employment opportunities, reduced numbers of accidents, less offending, and as already discussed, reduced alcohol and drug problems. The final misunderstanding I want to highlight is the criticism that doctors are using ADHD as a substitute for proper education or good quality parenting. I think this is really important because, as the saying goes, pills don't make skills. From the education perspective, we are highlighting that the medication itself is not teaching you anything and is not a substitute for good quality education. What it can do, however, is put someone in the position where they're more able to use available education opportunities more effectively. From a parenting perspective, treating core ADHD symptoms in a child can really reduce the levels of stress at home, allow the parent the space they need to optimize their parenting approaches, while at the same time putting the child in a space where they can take on board this positive parenting and manage their own behaviors. There's now good quality evidence that shows how people with ADHD across the lifespan are actually succeeding better in their education, at work and socially when they're taking their ADHD medications than when they're not. For me, one of the most important messages to share with someone with ADHD who's improved on medication is to remind them and those around them that they are the ones that have made the difference. They have changed things and not the medication. The medication may have helped them, but it's them that have actually done the hard work. So hopefully that helps to better understand the truth behind these myths. In the next sequence, we're going to look at the evidence supporting the neurobiological basis of ADHD.